Millions picture their arteries like household pipes, desperately searching for a supplement that acts like a liquid plumber to scrub them clean. But human biology does not work that way. Arteries are not inert pipes, and cardiovascular plaque is not a surface stain you can simply wash away. Enter nattokinase, an enzyme derived from fermented soybeans. It is currently the most heavily marketed supplement promising to dissolve plaque. We have to ask a blunt question. Does the proven biological mechanism of the supplement actually match the clinical reality in human patients? To answer that, you have to separate two distinct cardiovascular threats: fibrin clots and atherosclerotic plaque. On the left, a fibrin clot forms a sticky mesh to stop bleeding. On the right, atherosclerotic plaque is a fatty buildup trapped inside the artery wall. Nattokinase dissolves the fibrin mesh on the left, but cannot reach the plaque lesion sealed on the right. Does the chemical ability to break down a floating clot actually translate to shrinking a lesion embedded deep in the vessel wall? Confusing a clot buster with a plaque eraser creates a false sense of security. Relying on the wrong chemical mechanism leads to potentially fatal miscalculations in your cardiovascular strategy. Medical researchers do not measure plaque reversal by asking how a patient feels. They use reproducible imaging, like carotid ultrasounds, to measure the precise thickness of the artery wall over time. The definitive test for this supplement is the Nattokinase Atherothrombotic Prevention Study, or NAPS. This was a randomized, double-blind, placebo-controlled trial, the gold standard of clinical research. Researchers tracked atherosclerosis progression between a placebo group and one taking 2,000 fibrinolytic units of nattokinase daily. Fibrinolytic units are the standard metric used to measure the enzyme's potency. The results are clear. The result showed zero slowing in atherosclerosis progression. Plaque grew at the same rate in both groups, even at this standard commercial dose. You will hear about smaller, pilot studies claiming positive signals. Shrinking arterial plaque with a nattokinase supplement directly contradicts our best current imaging data. If your primary goal is shrinking arterial plaque, spending your money on a standard dose nattokinase supplement directly contradicts our best current imaging data. Failing to shrink plaque does not mean nattokinase is a useless pill. It has high utility for managing circulation. Clinical data shows it yields measurable reductions in blood pressure for patients dealing with pre-hypertension or stage 1 hypertension. By favorably impacting blood viscosity, it remains a highly viable natural tool for overall circulation optimization. A note of caution: because nattokinase actively alters the body's clotting system, the label natural does not mean risk-free. Look at this compounding risk equation. Combining this supplement with modern pharmaceutical anticoagulants creates a synergistic bleeding risk. Common medications like aspirin, Plavix, Xarelto, and Eliquis are designed to thin the blood. Adding nattokinase into that system creates a dangerous amplification of that bleeding risk. This synergistic risk even extends to combining nattokinase with other high-dose natural supplements, such as fish oil. Nattokinase must be treated with the exact same respect as a mild medication. Taking it casually alongside prescribed blood thinners introduces a severe, unforced physiological crisis. If nattokinase fails the imaging test for plaque regression, what actually succeeds? You have to look at Tier 1 supplements backed by hard human imaging data that nattokinase lacks. Aged garlic extract reduces soft, dangerous plaque prone to rupture. Similarly, high-dose EPA omega-3s are proven via CT angiography to alter coronary plaque volume and composition. These Tier 1 tools succeed where nattokinase damps. Next are pharmaceutical-grade omega-3s, specifically formulations high in eicosapentaenoic acid, or EPA. EPA is an omega-3 fatty acid critical for managing cellular inflammation. The success of these Tier 1 alternatives completely contrasts with the null results of the NAPS trial. The gap in evidentiary quality is severe. Successfully treating embedded plaque requires deploying strictly formulated biological tools, rather than relying on generic off-the-shelf hype. The golden rule of the supplement industry is that marketing is never a substitute for clinical evidence. Your next step is not a guess. It is a strict strategic decision based entirely on your unique cardiovascular profile. This flowchart maps the optimal path. To reduce plaque, follow Path 1 to Tier 1, aged garlic extract and omega-3s. To manage blood pressure, follow Path 2 to nattokinase. Taking anticoagulants, your path hits a red light. Stop. Consult your clinician. Optimizing your cardiovascular system requires aligning the correct biological mechanism to the actual clinical reality of your body. True heart disease reversal isn't found in a magic pill that promises to scour your arteries clean. It is found in the disciplined, evidence-based matching of the right tool to the right problem.